10-year-old Kayla Hand has the swine flu.
My eyes, anytime I closed them, they were burning and like tears would come out. And I had a headache and a stomach ache and my throat hurt.
Her doctor's ordering her to rest, drink liquids, and take a non-aspirin fever reducer. 99% of all cases of the flu right now are the swine flu because it's virtually the only flu strain circulating the country. Doctors expect the regular flu to hit this winter and the swine flu to come back again next spring. Pediatricians are seeing lots of swine flu cases every day, but most kids who get the virus don't need to see the doctor. Their symptoms are mild and they'll recover on their own. There are some, however, who need to seek medical attention immediately. Like if the child has difficulty breathing, is unable to drink enough because of vomiting or diarrhea, has difficulty waking up, has a high fever that doesn't respond to treatment, has asthma, heart disease, cystic fibrosis, or sickle cell disease. The percentage of complications from the swine flu is no higher than from the regular flu, but we're seeing more of them because the swine flu is very widespread.
There would be many more people infected by swine flu than regular flu because a lot of people have been immunized against regular flu, have had influenza in the past and have some immunity to it, but no one is immune, or at least most people are not immune to swine flu. So the virtual numbers of people that will be infected are going to be larger than regular flu, and there will be more people dying, not because it's a more lethal virus, but because of the virtual number of people that will be getting infected.
That's why doctors recommend children getting the swine flu vaccine, either the nasal spray or the injection, which are arriving at schools nationwide. Doctors say it's as safe as the regular flu vaccine because it's manufactured the same way.
There are always some complications from any of the vaccines we use, but there's no evidence that this vaccine has any higher side effect profile than the other flu vaccines that we have used in the past.
Now parents must decide whether to allow their child to be vaccinated at school.
My son has asthma, so I want to make sure that he is protected because I know he's in a high-risk group.
Because the swine flu is more prevalent in children, many hospitals are banning visitors under the age of 18.
We're here actually to visit my grandmother, great-grandma, for these two little guys, and so it's disappointing for them, but I totally understand that it's definitely in the best interest of keeping everybody safe.
Even children who look and feel fine are being turned away because when people get the swine flu, they often don't have any symptoms for the first 24 hours, but they're still very contagious.
If you're a mom about to have a baby, you probably would like to bring your other children in so they get to meet their new brother or sister very early on. There's a value to that, but right now we believe that the risk to the patients in the building of a child coming in exceeds the value of that connectivity.
More evidence that life is different now than in years past in an effort to control the spread of the swine flu. Lori Johnson, CBN News.